Just a quick note before we start, and hello, Victor. Thanks so much for joining. Okay, I think we have a lot to get through today, so I think we should go ahead and get started. Welcome everyone to our Careers in Healthcare event. This is part of Career Exploration Month. This event is part of a series of Career Exploration Month that is throughout the month of February. The Department of Ed is hosting events for high school students. Our goals are to learn about more diverse career opportunities in New York City, as well as gain an understanding of what choices you can make to be successful in those careers. You can find out about other opportunities via the flyer that we have this month. My colleagues could repost the slides just so that in case anybody who wants to see this flyer can go ahead and take a look at, and we hope you'll join us for other events. And just a few norms I want to set today. Some have asked, will this be recorded? Yes, we are recording this event. And so everyone who has attended, we will send out the link to you. We are very glad to be able to do that. We want to hear from you. Please put your questions in the chat. Just so you're aware, only panelists will be able to see your questions and comments. The chat will not be visible to other attendees. So please note for this panel, there will be a college student, two college professors, and people who work in the healthcare industry as part of the panel. We want you to think about the steps that you need to take in order to work in a hospital or other healthcare setting. So we want you to listen and have fun. We are excited for you to learn about this potential career pathway. There are a lot of people excited about healthcare, and I know I am. I love talking about it, so I hope you will enjoy learning more about it today. And for all of our students today, please fill out the attendance survey link. We'll post it several times throughout the event. We won't know that you attended unless you fill it out, so we encourage you to do that. And so a few of the organizations that are going to be represented today, we have two hospital systems, Montefiore and New York City Health and Hospitals. We have the 1199 Training and Employment Funds, so we'll find out about that organization and what they do. We have Borough of Manhattan Community College, and we have a student from Lehman College. And if you take a look, we have our list of panelists. So you might want to look at that a little bit more closely, just so you see who's speaking. So as we're doing the conversation today, be sure to refer back to the panelist list in case you have any questions or want to be able to ask a question directly. So I want to go through and talk to each of our panelists. And I think I want to start off with our hospital groups. So for Health and Hospitals, Michael Katzap, tell us about yourself and tell us also about where you went to high school and college and the position you now have in your career.
Hello, everyone. Can everyone hear me? Can you hear me?
Yes, we can hear you.
Oh, great. Hi, everyone. Happy Monday. Hope everyone's day is going great despite the winter wonderland that we had this weekend. My name is Michael Katzab. I'm the Director of Human Resources and Talent Acquisition for the New York City Health and Hospitals. I have been working for the New York City Health and Hospitals for about 20 years. The New York City Health and Hospitals is the largest public hospital system in the nation. If everyone here is from New York City, chances are there is either a hospital or another patient care site that is near you. So we are in all the 5 boroughs. So if you've heard of Bellevue Hospital or Coney Island Hospital or Harlem Hospital, Metropolitan Hospital, and so on, we have 11 hospitals throughout the New York City area. I'm born and raised here in New York City. I'm a product of public school education. I graduated from Edward R. Murrow High School in Brooklyn, and I attended CUNY School of Professional Studies, where I studied towards communication and culture's undergraduate degree. Uh, so one of the questions that I know that many have is, how did things change due to COVID? Well, I can answer that question in many ways. I can answer it on how the role of human resources has changed, as well as generally how healthcare has changed, especially in such a large system as the New York City Health and Hospital. So I'm not going to get too into the pandemic because everybody is familiar with what is going on and what has been going on for the last year. But because we are such a large system and we have facilities across the NYC area, one thing that we were able to do and do successfully is really share a lot of our resources. So when we knew that one of our facilities was getting hit very hard by the pandemic, we were able to kind of work together and align and move staff from one area of our system and to reassign them to help those facilities that were being very overwhelmed due to the pandemic. Specifically in human resources, um, one of the changes that we had to implement is kind of virtual onboarding for many of our hires. As part of our onboarding process pre-COVID, there was a lot of in-person touch points, which of course we had to change. So we had to kind of modernize the way that we did our hiring process. So we did that virtually, which was pretty successful. Um, so what can a high school student do to prepare themselves for a career in healthcare? All right, that is a great question. I have a lot of comments for that. I think one way of kind of moving along your understanding of the different fields in healthcare, when someone says they work in a hospital, that is so vague, or that they work in healthcare. There's so many different things that you could do in healthcare. You can be a nurse, you could be a social worker, you could be a doctor, you could be a coder, you could be a nursing assistant, you could be a pharmacist, anything. The number one thing I would suggest you guys do is really read, learn about it, Google. What does it take to be a laboratory technologist? What kind of nurses are there? All these different online resources are available. Another thing I would suggest you do is maybe tap into our different facilities to see if there's any volunteer opportunities. One of the best methods is to kind of shadow somebody that does work. If you're interested to learn what a social worker does, then maybe get a volunteer opportunity with a social worker. Really ask questions. Attend any events that are available, even virtually. So a lot of healthcare systems, they have public-based events where individuals can learn more about what's going on in those facilities. So it's really great to kind of learn more and attend those events. What skills and training would make a candidate a strong person, a strong candidate for any entry level role? So I think that also depends on whether you want to be touching a patient directly. So there's a lot of roles. My role is one of them where I don't really touch patients. I touch our employees. My team touches the employees to make sure that they have a very positive experience here at New York City Health and Hospitals. So really, it's really questioning on whether you want to have direct access to patients or whether you want to be more behind the scenes. Some individuals might want to work in healthcare finance, which is a great place to start their career. There's also other programs or training that you can take if you're interested in doing coding, or if you want to start from scratch working in nursing. You may want to take some training as a nursing assistant. A lot of employees that I've met, they've started gradually, where they started as a nursing assistant, then they became an LPN, which is a licensed practical nurse, and then they went to school, to continue their education, and they became a registered nurse, which is a BSN. And then sometimes they even grow into nurse practitioner roles, which require additional education. So really, the number one thing is do the research, ask questions, and volunteer, and just kind of get a sense of what other training and skills those individuals have, and kind of shadow them. The last question, I believe, is how does this industry accommodate employees with disabilities? Very well. We have employees from all different parts of life, and individuals that have different needs, and we do accommodate those that require certain accommodations. So if individuals do have a disability, don't let that stop you. Continue getting that education, learn, and really ask questions. That's really the number one thing. If you want to learn more about something, the only way to do that is to ask questions and to do your research.
You said so much in there, Michael. I just want to unpack a couple things.
Sure.
So as a human resources person, say quickly what that means and what healthcare credentials you had to have in order to be able to hire people in healthcare.
So the Human Resources Department is really an instrumental area within a large organization. So Human Resources is responsible for hiring, managing the workforce, managing employees, answering a lot of questions, making sure that employees are supported, that they're developed, that they're trained. Credentials that individuals have that go into the human resources field, many of them have something called SHRM credentials. That's something called Society for Human Resources Management. There are different types of training and certifications that one can attain to become a senior HR practitioner.
And what do you recommend the most for students in high school about how they should start preparing for their healthcare career?
I think the number one thing is really doing the research to kind of find out what all the different roles are. So if you're looking to do something in the laboratory, then check out opportunities, or really, what the qualifications are, what training or education is needed to become either a lab assistant, a lab technician, or a lab technologist. If you want to become a nurse, what kind of nurse do you want to become? So it's kind of getting a broader sense of the different kind of roles that exist in a healthcare organization. So you can work in healthcare finance, you can work in allied health, supporting our clinical staff, or you can do direct patient care.
And that sounds like a great segue to go to Anna Rodriguez, who can tell us about the kind of nurse you want to be. Do you want to tell us about you and your background and how you got to where you are now?
Sure. So good afternoon, everyone. My name is Anna Rodriguez. I became a nurse, I would say, about 17 years ago. Much like Michael, I am also a product of the public school system, and I received most of my healthcare in Bellevue Hospital. I've been working in Bellevue for the last 5 years. Prior to that, I worked at another city facility. And just a fun fact, Bellevue is the oldest continuously operating hospital in the US. We were founded in 1736 when Abe Lincoln was only 4 years old, right? So now we started off as a almshouse for poor people. We are now a 25-story facility that can accommodate 800 patients. It's a great place to work. We serve the underserved, patients who otherwise would not get care in other facilities, who cannot afford care, who are afraid of coming into the hospital because of many different reasons. So it's a really nice place to work. I was born in Brooklyn, raised in all 5 boroughs, and being a nurse, I mean, it wasn't my first profession. I was a social work first. I always knew I wanted to help people, but I didn't know exactly how. And when I became a social worker, it didn't really give me the joy that I was looking for. So through getting healthcare in the city facilities, I saw how the nurses worked, and I really looked up to a few of them that I saw very often. And I went in, I went to school, I went to public school. I went to City Tech College in downtown Brooklyn, J Street. Got my associates there. Then I went into Mercy College, did my bachelor's there, and completed my master's in Chamberlain College. I've been an ICU nurse for the majority of my career, except for the last 4. Now I do all of the hiring for Bellevue. And that also brings me great joy because I can now bring in all of the other great nurses who are currently going to, in school and are going at some point to become the nurses of the future, who's going to take care of all of us at some point.
I saw a great question in the chat for you. Are you scared as a nurse going up against COVID?
Absolutely not. We have been blessed in that we have been trained. We get training from, we have a special pathogens program in this hospital, one of 3 in the country. And because of that, we get very special training. And I could call them right now and say, I'm confused about something, and they will be here to help us, the students, any providers, anyone in the building. So no, we're not scared. We're always ready.
Very good. And two more things I want to ask you. What's the part that you love the most about being a nurse, and what's the most difficult part?
The difficult part is when your patients obviously they go and pass away, right? Sometimes you get very close to these patients and families, especially in the ICU setting, where they are at their most, critical state, and not being able to save them is always, a very hard thing. The most rewarding experience has been taking care of people who otherwise could not get the care. As a Latina myself, I take pride in knowing that I am able to care for people who are unable to probably get the care elsewhere, like your private institutions. So that makes it all worthwhile for me.
Very good. And you sent us a little information that had information about different types of nurses. Do you want to say a few words about that?
Oh, sure. So we have a lot of specialties in this facility. You have your med-surg nurse that they care for patients who are not as critical as they would be in the ICU setting. We have surgery department. We have OR nurses. We have ambulatory care nurses, which are our clinic nurses. We have PCAs those are the ancillary staff that work with us. We have CRNAs, and they basically function as certified OR anesthesiologists under the anesthesiologist in the OR, the doctor. We have midwives. What else? We're everywhere.
I think that's great that you said that, because I know a lot of our students are interested in nursing, and they should really start to think about the kind of nurse that they want to be and the sort of care that they're interested in giving to patients. Very good. I'd like to call on Ivy Mendez Justiniano. She's one of our co-chairs for our Career and Technical Education Healthcare Committee. Do you just want to say a few words?
Hi, good afternoon, everyone, and thank you for joining. We'd like to, first of all, tell you, as Michael stated, there's so many opportunities within the system, some of which are very common and well-known. So, for example, your nursing, your clinician titles, but there are so many titles to explore behind the scenes. So when you come in, and I strongly encourage volunteering, interning. Right now, as you know, because of COVID, we're a little bit limited in terms of what we can offer, but we're more than happy to offer virtual opportunities where you're able to get to know a little bit more about the different roles that we have, some of which may not be as common. So for example, within the healthcare industry, you can get information, or you can become accountants, business strategy individuals. And these are not even e-learning and gaming professionals within the field, so that you can train other clinicians. As Anna stated, in COVID, we've been training and developing e-learning modules. So that may be fun for you to do. So don't just limit yourself to the traditional. Be sure to be able to provide yourself with all the information you can. And please don't hesitate to reach out to myself or any other of the panelists. We're here to support you and to give you any information that we can. So we just thank you for taking the time to be with us this afternoon and investing in yourselves and your future.
Thanks so much for that, Ivy. I'm going to ask my colleague Jessica if you want to pick out maybe two questions from our wonderful students that we can give to our panelists so far.
Sure. So there are a lot of questions about volunteer opportunities. I'm seeing that come up quite a bit. So maybe that's the first one we could pitch to any of our panelists today. Any volunteer opportunities that may be available for high school students.
Sure. So we actually have a department in Bellevue Hospital that deals with volunteers as a whole. So if you're interested in that, I could find out the number. I don't know if, but I could find it out, and you can, yeah, anyone can really go in if you're really interested and apply for a volunteer position here.
Great. So Anna, maybe we can get that
Yeah.
information from you and we can include it in a follow-up email.
Sure.
to
And
everyone.
that's what Anna was stating. I actually put the Central Office Volunteers link on there.
Okay.
If you send us the information for what you're looking at, we can absolutely route you to all the different facilities. As I stated earlier, we're a little bit limited because of the COVID situation, but we're more than happy to use, to work with you to see if there's any virtual opportunities we can do right now.
Thank
Okay,
you
do you
so
wanna
much. And
Take one
Oh.
more.
yeah, I'm actually seeing a lot of questions sort of within the theme of, do you feel nervous about being a nurse? I think this is probably in light of COVID and other topics. And I know you kind of weighed in on that already. Does anyone else want to speak to that?
Yeah, I'll jump in. Hi, I'm Rahana. I'm a student. So about being nervous, right now I work with a lot of my colleagues at school who are really afraid for their own family, mostly not just for them tackling COVID-19 in the hospitals, but rather bringing it home. And to that, like I've told them, and I'm going to say it to all the students here as well, take care of yourself. We know exactly how to put on your mask, put on your N95, take a change of clothing to the hospital, do the best you can. And if you can quarantine at home, that's wonderful. If you can't, again, limit how much interaction you have with your family, perhaps, but there are steps you can take to limit your exposure. And as a nursing student right now, whenever we have COVID patients on the floor, usually they keep us away from them and away from COVID floors, which is which is obviously smart because you don't want to have new nurses or students on a floor where it's going to be high risk.
So Rahana, this is a great chance to segue to our section with you. Why don't you tell us about yourself, how you decided to do a nursing program, what you like the most, what you find the most challenging. And when we spoke earlier, you said that there's a difference between the in-person and online learning. I was wondering if you could talk a little bit about that.
Yeah, absolutely. So I am a second degree student. This is my second bachelor's, and I'm doing it in nursing. My first degree was in psychology at City College, and this was before COVID and everything. And the real difference is understanding that this distance learning really calls for you to be absolutely disciplined about yourself. You need to have the best time management. You need to make the time to bring yourself to study. It's hard at home because you're comfortable. So you really need to force yourself to sit down. You can't just go out to a Starbucks and sit and try to study there. You have to stay home and find that bit of time for yourself. And it's really easy to just kind of lie down and not think about things and procrastinate. And I've already finished a degree and I still find it difficult to manage that now. You just get too comfortable. So there is an absolute difference between being a student on campus and being at home. Another problem that we have is communication. I think the one great thing that came out of all of this is that it's really forced our education system to come into the modern world. You have to learn how to use technology. You have to understand how to make communication the best that you can have it. Right now, it's really hard to get somebody on the phone and say, hey, I need help with this. Can you help me pick out my classes? So it really forces you to kind of help yourself. Do the research by yourself, get all your information. If you need to pester somebody, pester them, and then bring all the information to your advisor. And that's when you can tell them, hey, this is what I found. You don't need to look for anything else. Just tell me, is this doable or not? And I will say that even during my first degree, same thing. Never depend on somebody else to be doing the research for you. Right now, we're in an age where you can just Google everything, literally everything, find everything for yourself, as much information as you need to get into a healthcare career or whichever career you want to go to. I'll put myself as an example. When I first started college, um, I kind of tried to stay away from healthcare simply because I didn't want to feed into the stereotype that South Asian women, all they go for is healthcare. So like within my first semester, I quickly shook that off and I'm like, no, I like healthcare. That's where I'm going to go. So I was actually pre-med first. And within a year of being a pre-med student, I joined every workshop I could to find out more information about it. If there was any MCAT clubs or anything, I joined everything just to get a real understanding of what this career called for. And for I've seen a lot of you asking about surgery and being a physician on the chat. Guys, understand that these kind of careers, you need to look for how much time you need to put into it, how much money. When you really think about it, the reality is it's going to take you maybe 13 years or more to become to become a surgeon, and it's going to take a lot of money. If you have the resources, if this is what you want to do, absolutely go for it. I have a lot of friends who are in med school who started off with me and they're doing wonderful. But then for me, I told myself, no, this is not what I want to do. I want to be in healthcare, but I don't necessarily need to be a physician to do it. So then I found out about PA. I know somebody here mentioned PA already. I didn't know what a PA was at that time. Thankfully, I was at City College where they had a PA program.
Sorry, PA is that physician's assistant?
Physician assistant,
Okay.
yes. So yeah, so I found out about physician assistant through classmates, went in, found out more about the program, and I actually thought, this is really attractive. So I went into PA, I did some shadowing at Bellevue Hospital with some PAs in internal medicine, and ultimately I was going for it, but I felt like something was missing. There was a disconnect between what I wanted out of healthcare and what I saw from working with PAs. They were absolutely wonderful and they were autonomous for the most part. But I remember one day I was looking for opportunities outside of hospitals that I can do as a PA. And I came across this volunteer opportunity that was looking for healthcare professionals. One of them wanted physicians who can work by themselves, obviously. Second one was PA, and you could not volunteer as a PA unless there was already a physician there. So I already knew that in order to work as a PA, you do need, especially in New York, you do need a physician there already. But then I came across something called nurse practitioner. I've never heard about a nurse practitioner. And I saw that they were able to do, for the most part, everything that a physician was able to do. And you didn't need to have an attending there. Attending meaning a physician that's going to look supervise. So they didn't need it. So immediately I started delving into the nursing career. I was very ignorant about what nurses can do, just the scope of practice that they have. I did not know how many different kind of nurses there were. I didn't know that you can actually move up, get your PhD, get your master's degree all in nursing. So immediately I looked into it and I said, wow, this is where it's at. This is
So, Hannah, we do need to move on to some of our other speakers, but there was a lot of great things in what you said, and definitely we'll circle back as we take more questions from students. I hope Dana Politis could take a moment to address our group. She is our other co-chair in our Career and Technical Education Healthcare group, and she is also Director of Workforce Development from Montefiore. Want to say a few words?
Thanks, Laura. Sure. So hi, everybody. Welcome. Hope everybody's staying warm and inside. It's a pleasure to be here always to support the great work that the DOE and CTE are doing. I know a lot of questions about volunteer services has come up. I'm actually typing furiously in the chat. So if any school or any student is interested, I'll put our email back in the chat, even though things are virtual. You know, we're coming up with really creative ways. I know Ivy mentioned the same thing, lots of jobs in healthcare. I have a public health degree. Now I work in HR. I have no idea how I ended up here. It's by accident, but I'm loving everything I do. And I have three amazing colleagues that are going to be talking to you, Will, Rich, and Victor. So I'm going to stop talking so I can turn it over to them. Thanks, Laura.
Thanks, Dana. And Will, I had to look up perioperative services. You want to tell us what it means
Surgery.
to be?
We've talked about nursing, we've talked about surgery. I've heard OR, and I thank you for that reference. So Will Bryant, Assistant Vice President for Perioperative Services here within Montefiore. I've been here for 2 years. Originally from Ohio, so all this cold weather stuff that you guys deal with, this something that I'm intimately familiar with. Surgery. So surgery is where, obviously, we do a range of different things, as has already been alluded to. We check patients in, we do the surgeries, robotics, neuro, cardio, thoracic, ambulatory, inpatient, emergency surgeries that come out of the ICUs, the EDs, we recover patients. So really that whole continuum of care, our team across 5 campuses here in the Bronx is responsible for. Um, One thing has COVID disrupted the fabric of life, unquestionably. I think there's more responsibility born for leaders out of this pandemic response now, more so than any other time that I can recall in the 12 years that I've been a leader. We do everything from COVID care, surge planning, vaccination program support, while trying to maintain day-to-day operations. um, One thing that I would encourage is, when you kind of think through high school to college and sort of, mapping out your career trajectory, the sooner you understand what path of travel you want to take, I think the more advantageous to any one individual it ultimately is. So then, you can set the undergrad to grad, and as well as your volunteer and other associated experiences around where you foresee your career ultimately going. As Rahana said, within nursing, you can go 1,000 different directions, right? I, probably about a decade or so ago, I pursued my MBA, ultimately did my doctoral degree, just finished up last year. But you can practice, you can teach, you can consult, you can lead, you can educate. There's just a number of different ways in which you can sort of carve out a niche within healthcare. The thing that I've come to appreciate just being here is it's not about what we do today, day to day. Rich will tell you, Dana will tell you, I think Victor will tell you as well. The ability to make an impact. This is sort of where we're evolving to here within Montefiore in terms of community impact, engagement, influence. Really, that's the lever that we're trying to pull right now, and further, share our experiences to help everyone from, those in elementary school, junior high, high school, college, those post, initial undergraduate degrees and so forth. So it's a very unique time, obviously, that just goes without saying, but within this sort of moment of time that we're in has presented such a different level of opportunity, to the extent that, our forums are no longer in person. We're communicating and interacting virtually. Okay, well, what does that mean? What does that represent? How nimble do we need to be as leaders to intersect and, continue to keep abreast, share the message, and so forth? So I'm enjoying the journey, enjoying my time here in the Bronx. Never thought I would have been here, but here I am, and, interacting and being part of great panels and opportunities such as this. So thank you for having me.
Can you say that again? Did you say MBA and then doctorate? And then, so I'm curious about your
I finished
pathway.
I did my MBA. So it was interesting, like Rahana said, you kind of hit that fork in the road. I was like 10 years into practice. What direction do I go? Ultimately decided to pursue an MBA as opposed to maybe become a nurse anesthetist. And from there, I connected with someone who was a director at a community hospital at the time. They needed an OR manager. My background was in OR nursing. I've been in the OR setting for about 17, 18 years now, and sort of one conversation presented the door opening, and then from there it's just been that continual progression as far as leadership experiences. Before I came here, I was in California. Far different experience being in Silicon Valley, the Bay Area. It's where if the Midwest and the East Coast is the grinded out mentality, the research, the innovation, the collaboration, the startups, which is very incumbent or very inherent to being out there on the West Coast, was something that I was supposed to. So, that's the other sort of message that I would leave is, don't shy away from opportunity to be exposed. I know we may grow up in certain areas, but if there's an opportunity, perspective just sort of unveils, it unlocks the door, and unveils opportunity. It opens your eyes, and it just enriches your perspective on whatever it is ultimately that you're going to do. So I've appreciated going from Midwest to West Coast back to the East Coast. So and to Dana's point, if there's any way that we can continue to be of support, be a value add to this community that we serve, our doors are open.
I love that you shared that, because that's important for students to hear, is that life can take you in a lot of directions, and that you keep growing and changing, and life will lead you to where you should go. So thanks so much
Absolutely.
for that. So Victor, I bet you see that a lot in your role as you are identifying people to be in certain roles at Montefiore, that they are changing as they're going through their career. Do you want to talk about what you do there?
Sure. I've been with Montefiore for about 7.5, going on 8, I guess. Come May, it will be 8th year. I support certain departments. So let's say we have about 20 recruiters, and each of us has a different departments that we support. So for example, I used to support Richard's department for a while, and now I'm a PA recruiter. At the same time, I have other departments. So each recruiters have a different role. Like Anna is, of course, background is a nursing. So naturally, she's a nurse recruiter. We have our own nurse recruiters. And so it's not just one area that I get to learn. And then doing so, ultimately, I guess, regardless of what we do, we are here to support the patients and their rendering their care. Our core value is same. It's about the patients and the community and how we can serve them. Okay. I think I've been reading the questions from the students. I think the common theme here from the panelists are volunteer and internship. And why is that important? How do we get a job, regardless of what credentials one might have? Just because you have a credential doesn't mean that it's going to be a guaranteed. So we need to network. And while you're volunteering, interning, every hospital's website have a volunteer office information. Okay. I think Anna was kind enough to provide you one. I'm not going to do your homework. There are a lot of hospitals that is close to you. And all you have to do is a couple clicks to get there, and you will have a volunteer information. Like people like Dana, they have wonderful workforce program that's partnering with such as NYC, Department of Education, to be named one. And we have many different programs that you can participate. So the most important thing that if you forget about anything that we talk about, I think you should look into and visit. It doesn't have to be necessarily be a hospital, but any healthcare related institutions, and see if you can go volunteer, because there are a lot of questions. Is being a doctor better than nurse? What kind of other jobs that we have? It's not about the type of jobs that attracts you, but it's getting to know what we do and what each title is enabled to do. So every job title has a job description. And that is one easy way to learn what is that particular title is requiring in terms of licensure or education, number of years of experience. So these kind of things that you don't have to trouble anyone, but it's readily available at every job posting site, I should say. So be educated as much as you can. Narrow it down to the titles or the job of certain professions, and you should concentrate on learning more. I think every panelist here volunteer to help you in one way or another. So use us to really learn about type of jobs that we have available in the hospital settings or in a healthcare setting in general.
And are there either jobs that you're doing a lot of hiring for, or trends that you're seeing, like with what we've been hearing? Is there more of a need for respiratory therapists? Are there areas that students may want to look into as the fields are growing?
Yes, I think every hospital right now, respiratory therapists are in dire need. And the other, I guess, I don't know, there's so many critical areas that we're looking for. Clinical lab technologists, I think Michael mentioned that. That's a very good field, and I think bachelor's degree suffice. You do have to get certification for that role, but there's a tremendous shortage in clinical lab technologist jobs. So once again, you have to research these titles and get to know what kind of demand that you're going to have by the time you finish that certain program in college.
Thanks so much, Victor. And Richard, do you want to tell us about your role and your function at Montefiore? And I think you're still, there you go.
Hi, I'm Richard Sepulveda. I'm the Director of Environmental Services. My job is to make sure the hospital is clean and safe for the staff and the patients. I went to school at LaSalle Academy, but before I talk about LaSalle Academy in college, I lived on the Lower East Side of New York City. Bellevue was a big part of our community. I was born there also. I went to school at New York University for 4 years. And after that, I started getting a series of jobs. I married early, had 5 kids, and I'm proud to say that 4 of them have graduated college, and I have 1 in Lehman College now, who graduates in 3 more years. Education is very important. And I'm speaking to the students out there. I know that some of you don't want to go to college, may not, but it's very important to have a college degree in order to get yourself into different areas. Now you're saying, well, you're housekeeping. Why do I need a degree? Because the only thing you're doing is cleaning. I will tell you that housekeeping is in every part of the hospital, from perioperative to the actual ICUs, units, MRI, and each cleaning is specialized. So yes, you do require a high school diploma to work at Montefiore. But one of the great things about working in housekeeping is as you're working in the hospital, you're learning different departments and you're finding out that, you know what, I want to be a phlebotomist, or I want to work in the laboratory. And when you're working up there and you're learning and seeing people doing their job, you'll know exactly what you want to do in healthcare. Because when I went to college, I wanted to be a doctor, and I went to pre-med. I ended up finishing with an accounting, a CPA accounting and computer analysis. I went into retail, manufacturing, education for 10 years until I finally came back to healthcare, and it was in housekeeping. And I really love what I do. And if you want to succeed, one of the biggest things, and this is the things, you have to have the right attitude. Education gets you in the door, but caring and having empathy and communication skills is very important. We work very close with nursing, administration, the doctors. I mean, there's not an area in a hospital that we don't collaborate with. So it's very important to have those skill scopes in our department. Now, one of the things that people ask is, how did COVID change our department or how we work? One of the things that it did was it made us more cognizant of how important EVS is to the hospital. So that everyone knows, EVS, we go into every room. We are more exposed to the COVID than anyone in the hospital. And it was prevalent when they did statistics, and they found that double the amount of housekeepers had COVID than nurses and doctors. And it's not just at Montefiore, but that's nationally. And we go in every day. our associates, and to clean all these areas. The great thing that I like about Montefiore is that here we had no fatalities. Our housekeepers go in there with a dedication because they know how important their job is. The other thing that it did, as for me as a director, my decision-making process has changed. I'm thinking about how am I get the supplies I need so we can clean the room. What training is needed, added training to keep the associates safe. So it has radically changed our life and the way we've done work here. I've already talked about that.
Richard, I love that you're on our panel because you are a reminder that every hospital is like a city and that there are so many different functions and each one is essential in order for the hospital to run. What are some of the most difficult parts of your role?
I'll be honest with you, as a director, my goal is to make sure that we get through this pandemics with no fatalities. Every day I get a call that one of my housekeepers is sick with COVID. And I know they got it. In most cases, they got it here or they were exposed inadvertently. So that's my biggest concern here at Montefiore. But like I said, we've trained our staff well. We have dedicated leaders, supervisors that go up on the floors to make sure that they're following all the protocols. And we've been very successful. I also,
okay. Oh, and do you find that some of the people that you hire, they use the opportunity, this is an entryway into working in a hospital system, they continue their education toward higher roles?
Absolutely. I'm proud to say that we're like the fishing pond. People recruit from our department. I mean, I look at phlebotomists, radiology techs, nurses assistant. Even I just last year graduated 2 nurses for RNs. So I'm very proud of that. We encourage that. We accommodate our schedules with that. And also I'd like to mention that 1199 has some excellent programs and they take advantage of these programs. So yes, if you're not sure what you want to do, but you know you want to come to healthcare, join EVS. We'll help you get to where you want to go. I also want to mention one thing that's very dear to me, and that's the work that I do with Dana and Victor and everyone with Project Search. We have a program that accommodates for disabilities. The people in Project Search are slightly autistic, but they're functional, and they're in the public school system. And we work with them collaboratively for a year to get them trained so they can be productive in the workforce. So we've been doing, EVS has been doing this. I've been here 5 years in the Moses campus, and we've been doing it for 5 years. Dana can elaborate more, but we do have accommodations for people with disabilities. And I encourage people with disabilities to move forward.
Thank you so much, Richard. And also providing an excellent segue to Dolores Chase from 1199. Thank you for being very patient. I know we have a very full panel. Please tell us about 1199 Training and Education Funds.
Okay, I want to say thank you to Richard. And I also want to say that I am a product of the public school system also. I went to Susan Wagner High School and also Hunter College at CUNY. I started out as a lab technologist, and then I went to work for the union and then subsequently to the training fund. So we offer all kinds of training and employment funds for our union members. We have about 600 employers that we cover, and 250,000 workers who are employed by 600 employers. So we have a myriad of services and trainings. And like Richard said, one of our biggest focuses is on the career path, and a lot of the pool comes from environmental service, transport, etc. We've had people who started out in environmental service go all the way through to become doctors, right? So we cover, high school equivalency training, all kinds of pathways that people could come in and out of. So it's not just that once you're on a pathway that you're locked in, right? We've had people go from being CNAs to LPNs to RNs to nurse practitioners, pharmacy techs to become pharmacists. So we work really hard with all of the members to find out what they're interested in. So what I would say in terms of being a high school student, what you should look for is you should really have some intellectual curiosity, right? Because sometimes healthcare can be hard, but as long as you're curious, it really takes you along the path. and find something that interests you, right? Because healthcare is not just RNs and surgical, like not the patients, not all the patient facing. And Michael had mentioned this earlier. It also has carpenters and electricians and engineers. So all of that, all of these titles are in the hospital. So find something that interests you. And also be aware of something that doesn't interest you. If you're afraid of blood, surgical technology is probably not for you, right? So be realistic about what you like and what you don't like when you go into the, when you start to look into different healthcare pathways.
And a few questions for you. So 1199 is one of the largest healthcare unions, and the Training and Education Fund is a different arm of that. Is that correct?
It is. It's jointly run by a board of trustees of half management and half union.
Very good. And your colleague Sarah always tells me that there's a big need for lab technicians out there. Do you want to talk about that a little?
Yes, actually, it's very dear to my heart because my first career path was as a lab technologist. So, and Victor had mentioned this too, that there's a huge crisis and shortage with laboratory technologists, which is a bachelor's degree, and also laboratory technicians, which is an associate's degree. A lot of the laboratory techs, both technologists and technicians, are retiring. So it really is a very interesting field. I went into the field because I worked in microbiology, so I found that interesting because it was always like I was trying to solve some kind of mystery about why was this person sick. So it really did interest me, but there is absolutely critical need for them.
And say again your pathway. You started Susan Wagner, which caught my attention, one of our CTE high schools, for career and technical education high schools. Tell us again your track from going from that high school to where you are now.
So I went to Susan Wagner High School. I graduated, I did an internship my last half in a veterinary clinic, which, science, I was really interested in science. Then I went on to CUNY Hunter College, where I started out as pre-med, kind of like Richard. And then I actually wound up finding out about this laboratory program for technologists. And then I became a lab technologist. So I have a bachelor's degree, a bachelor's of science in health sciences, in laboratory sciences. And then I went to work for Mount Sinai. I was there about 13 years as a practicing technologist. And from there, I went to work for the union and the training fund.
Very good. And say again your specific role at the training fund, because I want to make a point of students.
Okay, I wrote this down so I won't forget it. Okay, so I am an assistant director in the health and hospital sector. So what I do is I work with the union and management on training, joint projects, and employment opportunities for existing members and employment opportunities for future members.
And what's great about that for our students to know is that there are many roles in healthcare that may not necessarily be direct care of patients, where you can provide tremendous services either for patients or for the community or for people who work in healthcare, such as what Dolores does by working for the 1199 Training Fund. And so we wanted to explore some of those other areas as well, because there are many directions you can go in, and you have to find the one that's right for you. And to that end, we've had such a full panel. And last but not least, Lisa Grace from Borough Manhattan Community College. Please tell us about your department and what you do there and what you recommend for students.
Okay. Hello, everyone. Actually, funny enough, I'm also a member of the public school system, and I graduated from Hillcrest High School and from their nursing program. So just listening to the roundabout routes we've all taken, I'm like, yes, I've had a roundabout route in ending up as an associate professor at the Borough Manhattan Community College. At the Borough Manhattan, yes, Hillcrest High School. I went to Binghamton for my undergrad and realized, like other people, that I was interested in helping and working with people, but not necessarily as a medical doctor. So it was a little bit of, what should I do now? I didn't pre-med in college, and then I realized I was interested in health, so I went to Columbia to do an MPH and eventually got a doctorate.
Say what MPH is for our students.
It's a master's in public health. A lot of you in the chat are saying that you're interested in different things, but somebody actually mentioned they don't want to deal with blood. the health field, there's other jobs besides direct patient care. In BMCC, we have in my department, health education, we actually have 4 different degrees. We have a degree in gerontology, a degree in social work, a degree in public health, and a degree in community health. And within the community health degree, we have focus areas. If you're interested in health communication, getting to explain different concepts to individuals, okay? One of the things right now is the pandemic. One of the things that we found is that, yes, you're trying to educate people on wearing masks and social distancing. You have to do that. That is appropriate for cultural and language, different languages, different religions, etc. What is the training? So our program is kind of an introduction program. We have what is considered articulation agreements with some of the other 4-year colleges. We have with York, we're working with Lehman and Hunter and Brooklyn colleges. What that means is once you've completed our degree program, you can transfer directly into the 4-year program at these
So
other colleges.
your community health, is that correct?
We have community health, public health,
Public health.
we have
Yeah.
gerontology and school health.
Okay. And do you want to say something about each of those tracks?
Okay, well, as a lot of you say that you are not sure what you want to do, college, early college is a great time to try to figure out what I want to do. Within our community health program and our public health program, we actually have a brief internship component, which is virtual right now. The students are set up with usually a care agency, not sometimes with hospitals. It kind of depends on what your interest is. But like we have New York Cares, which is another volunteer agency that looks for students, and you see what you're interested in. A lot of our students end up going on to nursing, social work, some going to physical therapy. We've had a lot, a few actually went on further and have gotten graduate doctorate degrees at the end. So they've gone, you know, the community college, 4-year college, and then go on. There's
Do you want to say something about social work and counseling? Because that's a whole, we didn't really cover a lot of that. And I think some of our students would be interested in hearing about
one
that.
of the classes that you have to complete, it's a required class for our degree, is a health and counseling. Okay, in which you go and one of the main purposes of the class is to teach you how to communicate with different individuals and look at some of the issues that may be coming up. With community health, one of the things people always ask is, what can I do with this degree? Look at different clinics. You have people that work with diabetes counselors. One of the things we see now is we need more client navigators. Some of our students have gone on to volunteer or get jobs as client navigators within clinics and hospitals. So I'm not sure if there's anything else you want to know on that.
Okay.
I see.
Anything else you want to say about best ways students can prepare toward a healthcare degree, high school students?
For your high school students, this is your time to explore. Figure out what career you would like to do. Do your research. Okay. I think Richard said it best. You do need to have some kind of college degree. BMCC, their motto is start here, go anywhere. It is a 2-year college, and you can use that 2 years to try to figure out what exactly you would like to do. A lot of people that end up in our program, they came in, they thought, well, you know what, I want to be a nurse, but I'm not quite sure if I really want to be a nurse. So they use that time to take the classes. We have a comprehensive health education class that is considered our pathway class. All students in any of our degrees must take that class. So that gives you the overview on health, how it ties in to the social and environmental factors. We have a little career segue there that we built into that actual class, in which you get to explore different careers. Not everyone is going to be a doctor or a nurse. So it's like, what other careers can we do? Hence why we have the short internship component of it. We also, one of the biggest things I think our students enjoy is having our alumni come back and talk about their experience. Okay, you graduated from BMCC. Did you go on, what school did you go on to, and where can you go from here? The loan forgiveness attached. We don't have pre-dentistry within BMCC. We do have an EMT and a health information technology program. There are other colleges. I know LaGuardia has the respiratory therapy program. So there's a lot that you can be exposed to. It's just if you're willing to explore and do the research.
So go on that BMCC website, students, and see all the great programs they have there. It's the best way to learn about it and find out about some of the things that you might be interested in. So I know to my kind panelists, I originally said 3. If you're able to stay with us for an additional 30 minutes to answer some questions, we'd be really appreciative. If you have to go, we understand. I'm going to ask my colleague Jessica if you want to read out a few questions that have been coming up in the chat, and it can be for anyone on the panel.
Sure. So we have some variety, so many questions, so many good questions, but there are a few that were stood out. So is the healthcare field welcoming to diverse candidates and employees? And will I work with and for people who look like me?
Well, I know we had a great discussion about this at the Montefiore event, so I really hope one of you will take that, or maybe that's a good one for Michael.
Yes, look around the panel. That should give you the answer. I'm sure Michael and anyone in the HR would agree that we do not discriminate. In fact, we always try to encourage the diversity hiring. So as even the kind of level that we hire for a management, we are always encouraged and especially look for the diverse candidate. So I don't think that should be one of the bigger concerns working in a healthcare, for sure. You would not feel it. We do not exercise at any degree at all. So I think that's one of the least worries that you should have.
And Laura, if I could just add also,
Sure.
as part of the TEF's 1199 TEF's mission statement, is that we're committed to changing the structure of opportunity for historically underserved and underrepresented healthcare workers. So that's right in our mission statement. So, and we see that working with all the recruiters from all the different employers as well.
And Laura, if I can add, I think one of the things, guys, that you should think about is, we want to look like our patients, right? And it's not just about, what we look like, what language we speak. There's so many nuances to culture, our beliefs, diversity of experience, education, where we come from. There's so much, and we welcome it. And that's why, Montefiore and and Ivy and H&H have programs like workforce development, so we can get you guys to sort of meet those professionals that are just like you, that started like you. I'm first generation. I first started college. My parents were like, become a doctor or a lawyer. And I'm like, that's it. That's all they knew. And it was really challenging. And going to college was really challenging. But I've met a lot of amazing people. And I think Victor said it. You need to network. So you have amazing people that I network with right now that I'm looking at. So make sure to reach out to us, because it's not always that straightforward and it can be a little challenging. But the CTE team and Laura and Jessica do a great job. And, we keep putting our email addresses. Make sure to email us. We really want to talk to you, because we want you to be doing this panel 10 years from now, so we can retire. And then you guys can buy us lunch and pick us up in limos and do nice things for us.
Laura, I also just want to call on our colleague Eve, who's been responding with a bunch of really great resources. Eve, I know you've been posting a bunch in the chat box, but do you want to summarize a few things that consistent questions you're getting and the resources you've shared? Sure. Hi, everybody. I'm from the College and Career Office, the Office of Post-Secondary Readiness in the Department of Education. And so a lot of the links that I've been posting have been to training and certificate and skills programs that can help you get ready for careers in healthcare, or if you're looking for something that isn't necessarily college or college right away, there's some other options. One of the things I see the questions coming up a lot about, how do I decide what's the best college for me? Where should I go? How do I know if I can afford it? What about if I've got other people in my family going? And that's something you should always reach out to your college and career counselor or someone at your school who can help with that. You have a college and career office that you may or may not be aware of, but those folks there are working really hard to make sure they connect you to everything that you need to know about choosing the right place to go. And in some cases, it's not college, it is a training program and a skills program, and they can help you with financial aid and what have you. So I'm going to put something in the chat right now, and you'll see these 3 links that just popped up. The first one is the City University of New York offers certificate programs. Many colleges and universities offer a certificate program, and it's a way of getting training towards a field or career that isn't necessarily an associate's or a bachelor's degree. It's a good starting place. So there's a link to that. There's a lot of city agencies and organizations that are offering skills training and opportunities. Some of these have changed a little bit with COVID, but some of these are, we've done our best to make these the most updated lists of opportunities for you. So that's the second link. And then the last one is a site called One Degree. And that is a very local New York City site that can connect you to internships, training, employment, based on your borough and your interests. And that's a very new site. It's less than a year old, but they are constantly updating that. So check back often. Thanks.
I know one of the questions that I saw, some of our career and technical education students, they take certifications, and one asked, she's in a medical assisting program and she's going to get her medical assisting certificate through NHA. What should she do then with that certificate? Like, how does she take the next step for anyone? Maybe Victor or Michael might be good.
Oh, I still have trouble muting and unmuting. Can you believe it?
That's okay. We're all there.
Yeah, so once you have the certificate, there are several different certificates. There's a nurse's aide, there's a medical assistants, there's something called PCT, patient care tech, and every hospital has a different, we use slightly different titles for the same role. So once again, you have to read the job description very carefully before you apply to a certain position. I think just if you don't have any experience, do not afraid to apply to a part-time position first instead of full-time. Okay, so that's another way to, I don't want to use this word at all, but that will be your entry to a particular institution. And obvious reason, a lot more people are looking for a full-time job versus a part-time. So even a per diem in any capacity, once you have that certificate, go ahead and apply online, but make sure that you give a little bit more flexibility in opening your eyes and ears open for the part-time or per diem.
Very good. And Rahana, I saw you put a note there. Do you want to talk about certifications you're seeing that you might be seeing among your peer group, or any that you might want to recommend?
Yeah, so I actually did a phlebotomy certificate. I can't remember the name. I was trying to look it up real quick. But it's a career training agency in Midtown. For that one, you have to pay to get it. But for most of them, you do have to pay. I know while at City College, we would get emails from the Career Development Center that would send out opportunities like that to get into medical assistance and phlebotomy. Just look around at community colleges, at other CUNY colleges. Look on the actual CUNY website as well, and Google search it. You guys can find these. Don't worry. Google them; they'll pop up. And as for, sorry, a lot of my colleagues actually do already work at hospitals, so they're nurse assistants or CNAs and LPNs, and now they're working into getting their bachelor's degree in nursing. So you don't just have to run into BSN immediately.
And for all the students, you can either email us in the central office or ask your teachers to email us, because we can let you know about the colleges we have relationships with that you can talk to and explore more about the areas that you're interested in. So Jessica, do we see any other questions that we might want to take?
There's some specific questions around specific kinds of areas, medical areas, so dermatology and physical therapy. I saw that come up a few times. Can anyone speak to those kinds of opportunities on the call?
So I think I told Humera about this. I think I got lost in the chat. But for dermatology or any kind of medical profession that you want to go into, you have to first get through the 4 years of college. Make sure you can go in through any major you want. So if you want to go into art, if you want to go through music, you can. And medical schools actually look for that kind of diversity. So they're not just looking for biology students, chemistry students. They want that diversity. So get through the first 4 years of college. Make sure you're completing the prerequisite courses, which are your different science courses that need to be taken. Complete those, research the school that you want to go to, the medical school you want to go to, what their MCAT score is. MCAT is the medical school exam. Make sure you're going through workshops to help yourself get through the MCAT. It is a very tough examination. After that, you need to complete 4 years of college. During the 4 years of medical school, during those 4 years of medical school, that's when you get to decide what kind of specialty you want to go into. If you want to go into surgery, dermatology, anesthesia, anything you want to go into, you choose then. So after you're finished with medical school, that's when you get into a residency. And that residency is within the specialty you want to practice. So you do some research on the residency you want to go, the program you want to go into, how many years of residency they have, which kind of hospitals are associated with those residencies. But the foundation is the same: 4 years of college, 4 years of medical school.
Thanks for that. I think that's really important for our students to hear, because there's a lot of steps between where they are now and where they hope to be, and they have to think about how to take each one of those. Jessica, are there any others, or Eve, do you have anything else you want to share? We can close out with our survey, or happy to take some more questions while we have this fantastic panel.
There's lots of questions about whether this recording will be shared. So Laura, do you want to let everybody know how they'll get that?
Sure, it is being recorded, and we will send it out to everyone who signed up for this, and we'll email it out along with some resources within a day or so. Okay, well, while you're on the call, all of our students, I do want you to take this quick poll here. And we'll put our panelists up to vote, just so we get an idea of who's joined us today. And then we also want to think about, are there other sessions that we could be working to put together for you? As we could see, this is a really popular session. Healthcare is a great field to go in, and we really want to continue to serve you and have other sessions either throughout this school year or next school year, as we're working to provide you with these opportunities. This is fun watching the students take this in real time here. We'll leave it open another minute or two. And the other thing that we should do is make sure to post the attendance form again. We don't know if you attended today unless you fill out the form. I see some things about EMT and veterinarian. I know a good track for veterinarian is Vet Tech. I believe LaGuardia Community College is the only one that offers that locally. There are other vet tech programs throughout the state as well. And there are a few of our high schools have vet tech programs. If you want to reach out to us in the central office, we can let you know a little bit about what they do in those programs. Another's EMT, and we also do have a few high schools that do EMT programs, and a few of the community colleges as well offer programs and certificates, and then you sit for your EMT exam. EMTs are great. It's a great pathway that you can get medical training and then continue on and get more education to go on in your career. Let's share the results of what we see here so far. So we see the most from Brooklyn today. A lot of people interested in the nursing track. Also, Dr. Surgeon, glad to hear. And for those, we told you to put it in our chat if you have other tracks that you're interested in. Okay, we will leave this event open a little while longer. I hope our panelists can stay. We're happy to answer a few more questions. If there's anything else that we need to share before the end of our event, just asking my colleagues to chime in. And one thing on the line as well, for those of you interested in IT and technology, hospitals have very full IT departments, as well as data analysis is an important aspect. So I encourage you may want to put those interests together. Oh, does anyone want to say anything about research?
I can say.
Okay,
I can
go ahead,
speak about
Leslie.
research. So within medical research and clinical, there are so many different types of research, but research is a really important field, both clinical medicine and nursing fields, but also in public health. So it all, again, depends on what interests you and whether or not you want to work directly with patients or if you're interested in doing more behavioral and mental health research. But the one thing that I would say that would kind of sum up from what I can tell, a lot of the questions that you guys have is just keep going in the direction and being exposed to all these different areas, and you'll find something that'll set your heart on fire, and then you'll just go with it. I wouldn't worry too much at your level on kind of deciding for sure exactly where you want to be, but I would say as many opportunities as you have to explore both within the actual environment, so the hospital environment, or having the opportunity to work with some professors or scientists on research. Having those opportunities will give you the chance to really see what it's like on a day-to-day basis and to make a more informed decision. So the more volunteer internship opportunities you can explore, the more you can talk to professors on college campuses, the better you will be as you make decisions going forward.
And for career and technical education students in healthcare, we should be having our event with Memorial Sloan Kettering soon, in which you will have to write an essay. And the prize for the essay is that you receive an internship in research. It is a fantastic internship that many college students would be happy to have. So do those essays. That's how you get to those opportunities.
And Laura, if it's okay to share, my first job out of college was actually a research assistant. So it's a really popular job for folks that are sort of interested in healthcare but not sure. So I used to call people that wanted to participate. I learned how to draw blood. I used to fill out forms. So it's really great practice. And that's how I ended up getting into my public health degree. But Laura, I'm seeing a lot of psychology questions, and I happen to be married to a forensic psychologist, so I'm happy to answer those.
Please, please.
Yeah, so psychology is an interesting field if you guys are interested in it. It's a little bit different than medicine, but you kind of go to college. You don't have to major in psychology, but in order to be a psychologist, you do have to get a doctorate, so you can get a PsyD or a PhD. And after that, you have to work as an associate psychology and do a certain amount of internships. And when you get a certain amount of hours, kind of like social work, then you can apply for the licensing exam. And if anybody's interested, I can connect you guys to my husband. I'll let Laura know what his email address is. So happy to meet. And we have some great psychologists that work in hospitals too. So a lot of our psychologists right now are taking care of us and our staff that are in inpatient units dealing with COVID. So if anybody's interested, we're happy to make those connections.
It's an incredibly important field. I'm glad to see that students are
we love
interested
psychology,
in
guys. Mental health is super important.
And as well as social work, school for social work. It's generally a master's program that you do. You can be I want to make sure I get that right, but you get your master's in social work, so you do your undergrad, and the MSW is sort of almost like a certification that you need to be able to hold many jobs in social work. And it's also a very important field, especially in this city that has many social work agencies that much of the important work for the city happens in. Okay, questions.
So Laura, we have one from a biology teacher who says, I'm checking in and want to encourage my students to attend and would love to know if there are any life lessons our panelists remember learning in high school, whether in the lab or simply about work ethic required to be successful through so many years of school and training.
Oh, these are my favorite questions, and I see Rahana smiling, so I think you have to go first there.
Yes, so for high school, I think one of the biggest things that you need to remember is to not get distracted. So you can be this amazing student, but as soon as you get distracted, as soon as you get caught up in kind of living life and thinking that this is the moment for me to just be young, I don't have to think about tomorrow, you will find yourself sidetracked and you are going to regret that big time. So just remember, there is always a time for play. That just because you're on top of your schoolwork, just because you need to give a little bit more hours to your education right now versus hanging out with friends, in the long run, or just even within a year or two for some of you who are graduating, it is more rewarding. So the biggest thing I can say is don't get distracted. You're going to make friends. You're going to have opportunities. You're going to be able to hang out. There isn't even anything you can really do right now because you're in lockdown. So get yourself in the books, make sure you know what you want to do and you have your goals written out. What I find most helpful is to really write out every week what I want to accomplish throughout the week. And that way I know how much free time I have to do whatever else I want to do, while at the same time making sure that I'm still setting forth my goals and I'm meeting any requirements I need.
Come on, panelists, life lessons. This is the meat.
I think I don't even, high school was so long ago, I can't really say that I learned this in high school. But I think the one thing that I have learned is just the importance of excellence, and that no matter what you're doing or who you're doing it for, when you put your best foot forward, they remember you and they seek you out when they have opportunities. So I would just say, wherever life takes you, whatever opportunities that you have, that you take full advantage of them, and it will just open doors for you.
Very good. I saw our teacher, Ms. Savitsky, said, don't compare yourself to your friends. Your journey is yours. That's a very important one, that, we're all on our own journey and that things can take a different amount of time for each person. And that's okay. That sometimes you'll have different things you'll have to deal with, and sometimes your education might be put on hold for a while, or you might be able to do a lot in a short amount of time, but each person's journey is different.
I think that's one of the lessons, not so much just from high school, but I think the students can see from the panel that we all didn't have this straight linear path, that we just jumped into our ideal career. So students, just keep in mind that keep on going. No, we'll have some bumps in the road, some obstacles, but you don't give up. And you will eventually get to where you are supposed to be.
And guys, make sure to get rid of any negative people in your life who are telling you you can't do it. I know it's really hard when you're in high school because you have friends that may be going a different way or not interested. It's okay to do work. It's okay to study. It's okay to hang out with adults like us who know what we're talking about. It's kind of, so don't be afraid to cut some folks out of your life if they're only going to bring you down. You have that potential. I think that was a really hard lesson. I used to have a best friend, and I think it took me until graduate school to realize that she was not good for me. And after that, things changed. So make sure to keep all those good friends and people that support you, like your families and your teachers, close by.
I would add to that, explore, explore, explore. So when you're in high school, you may think that your career or where you want to go into is a particular direction. Be patient with yourself. The more you learn, the more you explore, the more you're going to open up yourselves to many different opportunities. And those opportunities are eventually what are going to lead you to where you're going to end up. So if you're thinking, so for example, when I left high school, Back then, I was a secretarial studies. Then I went on to be MCC. I went into respiratory therapy because I wanted to help those individuals. And I was a great student. And as a respiratory therapist, I can tell you, I can remember right now, I can intubate, I can do everything. But did I enjoy that? When I was in my clinical rotations, I realized this is not for me. And here I am years later. I've been in hospital management for more than 25 years and never realizing this is where I would end up. But had I limited myself and stayed the course of this is what I want to be and never explored other opportunities, I would have lost out on a lot, because right now I absolutely love what I do. I absolutely love the work and the impact that I have on people. So be patient with yourself. Where you start off may not be, is almost always never where you're gonna end up in.
I think that's a really great note to close on as we're closing in on 3:30, that you need to love what you do, and that this is a field where you can help people. And that one of the most important aspects of working in this field is that you have to have compassion and empathy. You have to care about people. And it may be hard. There might be a lot of difficulties and learning all the things you need to learn, but you will make people's lives better by being in this field. And that we know that we still have 524 awesome attendees who are hoping to do that, still on the line. Okay, I think we're going to close out as we come to 3:30. Thank you so much to all of our panelists. I only wish I had an hour and a half intensively with each of you in order to be able to share with our students. You've been terrific, and we'll probably be reaching out in the future to get a little bit more information that we can pass on. And students, thank you so much for being here. You've been terrific. We're really excited that you have so much enthusiasm for this topic. Your questions and comments were just A+, and we're going to share as much info as we can with you.
Thank you. Good luck, everyone.
Thank you, everyone.
Have a wonderful day, everyone.
Bye.
Thanks, Corinne. You and Jessica were lifesavers.
No problem. That went really well.
What a fantastic panel. I know it was crowded, but it was really great to have them all there.
Yeah, I think it was really good to have that diverse range of people. I think that was key, that they all had kind of different specialties.
Very good. Just letting a few students know. We'll put contact info. And while we're on the line, Corinne, when Jessica and I passed off the hosting, all of a sudden I lost host control. So but then she handed it back to me. So just be aware of that, if in case you're sharing any kind of controls, that might happen for you, because this is.
Yeah, I noticed that. I can't remember what event I was doing, and I think Treva. Oh, I remember. It was during the PD day. Treva gave me host control of one of the sessions, and then she realized that she lost control.
So you know that you've done that before. Yeah, because it's not our own accounts, because if it's our own account, then we'd still have it. Yeah.
Yes, exactly.
Yeah, so good to know. Okay, I think I'm going to close out. Thank you, students who have joined. Okay.
Bye, Laura.
Bye.